I'm Dr. David Frumberg. I'm joined today by Dr. Jill Flanagan from Children's Healthcare of Atlanta on the Fix. Welcome.
Happy to be here.
All right. I understand that you brought a case for us to discuss today.
Absolutely.
Why don't you tell me about this?
So the case I brought is a 15-and-a-half-year-old girl. She's fully grown, and she has a condition called Congenital Femoral Deficiency. And what that means is that she was born with her femur, which is her thigh bone, it was short. And unfortunately, she got to me when she was done growing, which is what she was told to do. But she comes in with a difference of 8 centimeters, which is over 3 inches different.
So why'd she come in at 15 and a half?
Well, I think things are certainly different now than they were before, but she was told that really nothing could be done until she was done growing. So she shows up and says, "Okay, doc, fix me."
Oh my goodness. If you had met her earlier, like let's say 6, 7, 8 years of age, could you have done something different?
Oh, absolutely. I think with a diagnosis like this, I think the sooner a family can get to me, the better, for a lot of different reasons. One, I get to know them, and the more I get to know a family, the better the relationship comes, which I think really is going to translate to when we do these lengthenings, which are pretty complicated surgeries. And 2, I have more options. Growth is our friend. So at age 15, really the only thing I can do is grow her bone and grow it longer. If she's younger at 7 and knowing she's going to have this 3-ish inch difference, it affords me more options of when am I going to lengthen the bone? And I think a lot of that depends upon what's going on in life. And then I can, in theory, stop the growth on the other side a little bit. So maybe I'm just doing one lengthening, but with a 3-inch difference, or in her case, slightly more than that, when she's done growing, the only option really to make her equal is, in my mind, two lengthenings.
So 2 lengthenings of the bone and the limb segment. These often grow a little bit crooked when they're younger. Is there anything you could do to kind of get it to grow straighter?
Right. So children that are born with these congenitally short femurs, it's a misnomer because it affects usually the entire limb. Oftentimes the hip isn't formed correctly and we're doing some kind of hip reconstruction surgery. This girl was really lucky. Her hip was actually fairly normal. Their knees often don't have an anterior cruciate ligament, which is, I have to say, lots of different athletes tear that, but she didn't tear it. She just wasn't born with one. And oftentimes their ankles are stiffer, and down in their feet, sometimes there's some bones that are stuck together so that they can't twist their inner foot in or out as much. So there's usually a lot of different things that are affected. And almost always the bottom portion of their thigh bone isn't as well formed, so they tend to be knock-kneed.
So at 15 and a half, she's knock-kneed and very short.
Yes.
What were your options? Did you get some x-rays? How did you figure out what to do?
Right. So I think the first thing to know is, okay, what are we dealing with? How short is this bone and how crooked is it? So again, it's about 8 centimeters short. So again, a little over 3 inches. And she's knock-kneed about 8-9 degrees, which doesn't sound like a lot, but it's pretty substantial. And when examining her, luckily even though she had been walking on her toes for several years, she luckily was able to stay relatively flexible, which was good.
So it's an active kid.
Absolutely.
Good. So yeah, I mean, this stuff doesn't slow them down, so.
It doesn't.
Okay, so I understand the case, we see the x-rays. What'd you do in the operating room?
So actually, even before then, I think what's important to know is have a discussion with the family. What are their goals? You've come here. What can I do for you? How can I help you? What are your goals? And I think that's important. Doc, I don't want to wear a shoe lift anymore. Okay. Doc, I just want to be normal by 25. Whatever that is, I think it's important so we can talk about, is this goal realistic? Because again, if their expectation doesn't match what I can do, it's just not going to go well. So I think it's really important before you go to the OR to do that. That being said, we talked about it. Doc, I wanted to go as smooth as possible. I'd love to not wear a lift the rest of my life. I'm hurting. I want to get better. Okay. So in this case, we talked about lengthening her 5 centimeters, which is 2 inches, and then getting rid of the knock-kneed appearance. And to do that, at least in my hands, I think the best approach is to do a lengthening that goes through the knee, so going backwards in the femur. We call that retrograde. And not only can I lengthen the bone that way, but I can correct it and make it straight.
So sort of straighten it out while she's asleep.
Exactly.
And then, because you're going to cut the bone anyway.
I'm going to cut the bone anyway.
Straighten it. And then you can lengthen it gradually, or how's that work?
So in this particular case, I used something called a Fitbone nail. And the way that it works, it's electric. So surgically break the bone, and then I have it planned ahead of time how I'm going to break it, where I'm going to break it, and then how I'm going to angle the nail into the bone to ensure that at the end of the day, the limb looks straight. So that's all planned ahead of time. So at least when she leaves the OR, her leg is straight. And then with this electric nail, I can gradually lengthen it. The bone is easy to lengthen, although if I lengthened it once, we wouldn't make bone, we would just make soft tissue. So we have to grow bone, which is a very delicate process. And it's a really case-by-case process. But to lengthen the soft tissues in somebody with a short femur is very difficult. So we really want to manage that soft tissue well. So we do it gradually.
Did you do anything special for this case, knowing that the whole thigh is deficient, the tissues may be tight or loose or whatever?
So in this particular case, this girl, anybody on the outside part of the leg is something called the iliotibial band or IT band. And you can feel it on yourself. It's tight on everybody. And it doesn't really have a lot of give. And so when we're lengthening, especially on someone with a short femur, it's really important to cut it. It doesn't really affect function at all. But in our hands at lengthening, if it gets tight, it can actually dislocate the knee. So
that sounds horrible.
It's something I have not done and I don't want to do.
So how'd this case go?
Surgery went really well from my perspective, and actually from hers too. So I was able to successfully get her knee straight. And then we started lengthening about 10 days later, sent her to physical therapy. I think the hardest parts for the families are really dedicating their time to physical therapy while going to school. I think can be a challenge, but again, we're there with them every step of the way.
And then, so did she achieve her full length with no hiccups?
One hiccup, there's always a hiccup.
Always.
So, and again, stressing why you have to come back to see the physician is so critical. So with her, probably about a centimeter to a centimeter and a half into her lengthening, I noticed on her x-rays that her knee was starting to dislocate backwards, which is something we certainly look for. And with that, what we do is, even though our goal is to lengthen, you got to stop. If I lengthen her more, I'm going to make her worse forever, and I can't undo that. And so we stopped her lengthening. We were really aggressive with physical therapy, got her knee back to where we wanted, and then we were able to continue lengthening the rest of the way.
Did she achieve the goal of 5 centimeters?
She did. I was really proud of her.
All right. Well, how's she doing now?
She's doing much better. Her hip and knee pain that she had before is now gone. She's no longer walking on her toes. She has a much smaller shoe lift because she still has about an inch and a half left to go of lengthening, which hopefully she'll let me do that in a couple of years.
Much more manageable situation.
Absolutely.
Plus the leg is straight now, so that's
Absolutely.
good as well. Well, thanks for sharing that case with us, and thanks for watching us on The Fix.